As your mitochondria become more dysfunctional, that's how we age, that's how we eventually die, because the mitochondria are important for producing.
Meet Dr. Christopher Davis, a triple board-certified integrative interventional cardiologist and chief medical officer at Liquivida.
He's also the founder of Reveal Vitality and the chief cardiologist at the HumanN, bringing a wealth of experience and innovative health solutions. Join us as he shares invaluable insights into heart health and holistic wellness.
Longevity science is 25 years ahead of medical practice. From where you started before with your cardiology practice to where you're at today, it is a whole different type of medical practice.
We get sick and we get old because of the environmental toxins that we are exposed to. Full stop.
The consumers that listen to the podcast can kind of really understand what is oxidative stress and how is oxidative stress caused in the body.
If we think about a 100-year-old house, 200-year-old house, and the pipes that actually feed that house, within those metal water pipes over 200 years, there's just layer upon layer upon layer of that rust that grows inside. So in our bodies, over time, just think of the rusting that goes on within our arteries. That's oxidative stress.
Dr. Davis, if a new provider that's just getting into this health and wellness industry, if they were to ask you, what is the number one thing that they should probably focus on right from the start?
So
welcome to another episode of a Healthy Point of View podcast. I'm your host, Sam Tejada, and today we have one of my favorite guests, Dr. Christopher Davis, our Chief Medical Officer at Liquivida. He is an interventional cardiologist with a hyper-focus in functional medicine on the cardiology side. So today we're going to pick his brain a little bit more. Today's topic is going to be about longevity science is 25 years ahead of medical practice. Dr. Davis, welcome.
thank you, Sam. Always good to be back. Always good to be
Absolutely.
back.
Yeah, man. So longevity science is 25 years ahead of medical practice. Why is that our topic? What does that mean?
Yeah. So I really wanted to talk about, why, honestly, why I do what I do as a physician, why, we've brought a lot of the technology and therapies that we've kind of brought into Liquivida. So I thought it would be a good topic to talk about, what's possible that most people might not know about as far as their overall health and improving health span. So I really want to talk about some of the things that may not necessarily have double-blinded, randomized trials out there, but they actually have outcomes, right? When you look at your clients and you're able to reverse things like Parkinson's disease, and I said reverse, when you look at heart disease and predicting heart disease or predicting cancer way before technically we would be finding them otherwise. So I want to kind of just give our listeners some of the technologies, some of the therapies, some of the possibilities that are out there so that they can really take some time on their own and research what's possible.
What's possible?
Yeah.
And Dr. Davis, I've been fortunate enough to be next to your side for the majority of your journey on this whole functional medicine side.
Yeah.
And it's been a journey. I mean, that defines it right there. And from where you started before with your cardiology practice, a very successful cardiology practice, to where you're at today, it is a whole different type of medical practice.
Yeah.
And that has taken a significant amount of time, a lot of research, a lot of connecting with other experts in the industry. And, I always tell you, you got to share this stuff. You got to share your story because you're actually reversing certain illnesses and diseases. You're seeing people change their life for the good.
Yeah.
So today we're going to take the time to really talk about that journey, what you've been truly able to learn, because this is the thing too. You already know how many doctors and providers listen to this podcast, and there's a lot of crazy stuff out there, a lot of snake oil.
Oh, yeah.
So, and we've been caught up in some of it before, and then you start noticing, say, hold on, no, we're not doing this.
Right.
But you've been able to really sit down, research a lot of this stuff, and now you're going to share the things that work and what people need to look into.
Yeah, absolutely. Coming from an interventional cardiology background and just getting frustrated with the current medical system, and meaning that, it's kind of a revolving door. Patients come in and they have high blood pressure. We put them on their blood pressure medication, and the blood pressure normally still is high because we don't really teach them the things or address the underlying reasons why their blood pressure is high. And they come back and the blood pressure is high, and we up the dose or we add another medication. And I call that Band-Aid medicine. And after 10 years of practicing medicine like that, and even things from like having a heart attack and putting a stent in arteries, and I think that was very gratifying because you saved a life. But at the end of the day, when they come back 6 months later, did we truly save their life, or did we truly help that person as much as we could have as a physician? And so
Right.
for me, it was definitely about kind of expanding what we had to offer for my patients. And so it's definitely, as you said, been a journey, right? When I decided I was going to do something different, literally, I was so afraid because I didn't know what that even looked like. But fortunately, over the past 6 years, what I learned about myself is that I love to learn. And so as we continue to learn about what's truly possible, like I said earlier, all of these new therapies and technologies, it just continues to evolve. I've evolved from a cardiologist to a doctor who deals with all kinds of stuff: neurocognitive health, cancer, heart disease, autoimmune diseases, because there's an underlying root cause, and sometimes there's a commonality among the causes of all of those things. And we've
Right.
talked a lot about with the things that we're doing now with environmental toxins, right? Every disease I just said, every one of those chronic diseases are somewhat and somehow related to environmental toxins. And so we'll probably get into that a little bit later. But so suffice it to say, it's been an exciting journey to continue to learn. And as we learn the things that are out there and you put them into play and you try to, you present these things to your patients. And I mentioned earlier, I had just past week a gentleman who has Parkinson's disease. And one of the things I'll talk about just really quickly is, neurocognitive. The neurocognitive sciences, they have truly evolved. There's some work out there about molecules called plasmalogens, which are fatty acids, right?
Mm.
And these fatty acids are incredibly important in the neuron function. And this is all Dr. Dayan Goodnow, and I'm going to give him, much respect for all of the work that he's done. But I can tell you that if you start to look at the work he's done and we start to measure plasmalogen levels in patients who have Alzheimer's disease and Parkinson's disease and ALS and multiple sclerosis, and when you replete those plasmalogens, it is absolutely amazing the benefits you may see.
How do you measure those levels?
So plasmalogens, Dr. Goodnow has a patented lab panel called a prodrome scan. Okay, and that
Blood work?
prodrome scan, blood work, just
Okay.
blood work. Prodrome scan that actually measures all the different types of phospholipids, but in that they're measuring plasmalogens as well.
Okay.
So, just, an incredible story just this past week. I'll tell this story because it's kind of funny. I was sitting in the hyperbaric chamber in my new longevity center, which we'll talk about a little bit.
I
But
can't
I
wait
was
to
sit-
visit that place.
I was sitting in my hyperbaric chamber and I got a message from a patient. Please call me because this is nothing short of miraculous. And there was a patient that had been really getting ready to see one of the second or third neurologist they had seen, and he had a tremendous tremor and all the faces and movements of Parkinson's disease, and he had this tremor in his right arm that was getting worse and worse and worse and worse. And so over the last couple of weeks, I had told him, hey, I want you to start doing some red light therapy, photobiomodulation, and we had gotten his prodrome scan back, and he had very, very low, non-detectable plasmalogen levels. And we started to replete those plasmalogens with a supplement from Dr. Goodnow. And literally, okay, and this is what she says in her, and I have this on the slideshow now because she sent this on a message, and she said, within 2 doses, the tremor had gone away, literally.
Like gone away completely.
Gone, okay?
Wow.
And even now, we're just a week out. This is brand new information that I'm talking about here, but and even now, we're 5 days out. I think this was Monday or Sunday night when I talked to them. The tremor is still gone. Okay,
That's amazing.
These are the type of things that sometimes I get shocked when things like this happen as well.
How long
because
did they have the tremors for?
for years.
Years.
Yeah, and it's and getting worse and worse and worse. So we're still doing some other work with him, but I bring that up because it's that type of thing that's incredibly rewarding. Any physician who goes into medicine to truly help people, when you can get a response like that, and that's just one of many things I could talk about with the type of medicine. When we talk about longevity science being 25 years ahead of medicine, those are the type of things that I'm talking about.
That's rewarding right
Yeah.
there, man. That really is. Dr. Davis, if a new provider that's just getting into this whole health and wellness industry, if they were to ask you, what part, like what system of the body or what cells or what is the number one thing that they should probably focus on right from the start?
Yeah, yeah. Um, so in today's day and age, the hot topic of all chronic disease, or what's affected is our mitochondrial function, right? I think that anybody in the functional medicine space, anybody in the longevity space, the topic is all about how can we improve mitochondrial function, mitochondrial biogenesis, because as your mitochondria become more dysfunctional, that's how we age. That's how we eventually die, because the mitochondria are important for producing ATP, our currency of energy, right?
Right.
So if I had to say there's one thing you're focusing on with every approach, everything and all these therapeutics that I'm talking about, whether we're talking about the plasmalogens or whether I'm talking about hyperbaric oxygen or light therapy or cryotherapy or saunas, all of these therapies are designed to address improving mitochondrial function. So,
Right.
and there are lots of parts to that. And how do we improve mitochondrial function? Supplements, IVs, all of these other therapies we talked about. But if there's one focus that we should have is how do I improve my mitochondrial function?
Okay. So a lot of focus on understanding how the mitochondria works.
Yeah, yeah, yeah,
Everything related to it. Yeah, because some people they'll start looking. So, well, I got to learn everything about the metabolic pathways and
yeah, yeah.
the Krebs cycle and this and that, and people get a little bit confused at first. There's so much information out there, but if there's one point to start at,
Yeah.
mitochondria.
Yeah, and that's a little bit. It is. I won't. That could be overwhelming too, because understanding mitochondria is not an easy thing. So if I had to back up and I want to think a little bit higher level, okay, it's about. Let's just start with understanding nutrition. Let's just talk about proper nutrients and getting the proper nutrients so the mitochondria and our cells can work appropriately. Diving immediately into mitochondrial function, if any physicians or other practitioners that are listening, back in medical school, in first year of medical school, we all learned about this Krebs cycle or TCA cycle and all of the components that go into that and the micronutrients that are needed for the Krebs cycle to work. And that's a bit overwhelming, but it is incredibly important to understand that and understand what's called the electron transport chain, how energy is produced through these certain complexes on the inner mitochondrial membrane. It's a little bit scary to think through all these complexes and understanding, how the different complexes are utilized. So I don't know that I would jump in and try to understand all that immediately. I think that one way to look at it is just trying to balance our oxidative stress and antioxidants is one way to think about it. If I want to think a little bit higher level, and our oxidative stress, our mitochondria are actually what helps us produce energy, but the mitochondria are also the cells that produce most of our reactive oxygen species, most of the oxidative stress. So that's a little counterintuitive, right? Because we always think of oxidative stress as a bad thing. Well, first of all, oxidative stress is not necessarily always a bad thing. In fact, we have to have oxidative stress, and otherwise we'd all have infections and die from these infections, because it's oxidative stress that helps to kill off a lot of these organisms and pathogens.
So
right?
let's bring it down a little bit a level, right?
Okay.
Just so the consumers that listen to the podcast can kind of really understand what is oxidative stress and how is oxidative stress caused in the body.
Yeah. Well, to put it in layman's terms, I always say this. If we think about a 100-year-old house, 200-year-old house, and the pipes that actually feed that house, the water pipes, within those metal water pipes over 200 years, there's just layer upon layer upon layer of that rust that grows inside, right?
Right.
And that rust is oxidative material in those pipes.
Right.
And so in our bodies over time, just think of the rusting that goes on within our body, within our arteries. That's oxidative stress, all right? And so we need these antioxidants to help to prevent the oxidative stress from forming. And what causes this oxidative stress? And again, I don't want to get too much all these scientific terms of reactive oxygen species and the different ones, superoxide dismutase and catalase and hydrogen peroxide and hydroxyl radicals. We need antioxidants and antioxidant enzymes to help break down these oxidative stress, these reactive oxygen species.
And if it doesn't break down that oxidative
Yeah,
stress,
there's an imbalance
what
there.
ends up happening
Right.
to the body if you don't have those antioxidants?
Yeah. So one of the ways to think about it is oxidative stress causes more inflammation, and inflammation causes more oxidative stress. And you get in this rampant circle. And we all know that lots of diseases are caused by inflammation, right?
Okay.
Inflammation causes the pain in my elbow or my shoulder. Inflammation causes rashes on my arm. Inflammation causes heart disease, right?
Right.
So we all know that inflammation is something that, again, it's not always bad, okay? But we try to mitigate, or an overactive inflammatory response is problematic. This whole concept of inflammation is part of us getting older as well.
Okay.
And so it has to be this delicate balance of this whole system. So oxidative stress is driving that inflammation as well. So that's why we have to maintain that balance.
So when you say inflammation is not necessarily always bad, would that be the difference between acute inflammation versus chronic inflammation?
Oh, absolutely. I mean, for example, I injure my foot, I twist my ankle, or I have some type of injury. Well, part of that injury that to get better, I need to deliver blood flow there. I need to deliver the white blood cells to actually start that healing process, right?
Right.
So the acute inflammation part of it is not necessarily a bad thing. If I have an infection, right, and I need to get rid of the pathogen that's there, how do I get rid of it? I need to have that inflammatory response to actually deal with that pathogen.
That's like an immune response.
Exactly.
Right.
If I don't have that inflammation, then guess what? That pathogen is going to continue to thrive, and it's going to be a
Right.
problem.
Okay.
So, but there has to be that chronic that's acute inflammation. When that process continues to go on, okay, out of control, that's when we run into problems.
Right. Right. Now you mentioned you got to have antioxidants to
Right.
bring that oxidative stress down.
hmm
What are some of these antioxidants that people
Yeah.
should take?
Yeah.
For
So I think that one of the most important antioxidants, if we think about, what's the most important antioxidant in our body, and that's probably going to be glutathione, right? Our liver makes glutathione, and it is a process that it requires the right micronutrients in the liver to do that. And there are other from a nutrition perspective, we know things like vitamin C and vitamin E and vitamin A and alpha lipoic acid. These are all antioxidants as well. So there are some very potent polyphenols and flavonoids in the foods that we eat that are antioxidants as well. But if I had to say the most important and that has the most role in providing this antioxidant effect, it's going to be glutathione.
glutathione.
Yeah.
And what are some of the other antioxidants? Because obviously you could get antioxidants from supplementation,
Mm-hmm.
right? And then you could get antioxidants from certain foods
Yeah.
as well.
Yep. So lots of ways to improve your oxidative stress balance, and that's also known as redox balance. So the supplements we talked about, mean the vitamin C, vitamin A, vitamin E, alpha lipoic acid. Other things that upregulate glutathione. How else can we upregulate glutathione? Well, glutathione is made by a transcription factor in the liver called NRF2. And how do we upregulate that? Therapies like ozone, right?
Okay.
Therapies like hyperbaric oxygen, okay? There are molecular hydrogen. Now, if I had to think about the newest kid on the block, and I haven't mentioned this yet, and we will certainly be hearing more about this, is molecular hydrogen is an incredible antioxidant. And I like to think about molecular hydrogen as an adaptogenic antioxidant. What does that mean? It'll never be too much of an antioxidant, and it'll never be too little of an antioxidant. So molecular hydrogen is always is kind of just right. Now, how that is physiologically, I don't know. I can't really explain that right now. But we know that if I were to think about right now some of the things that I'm utilizing within my practice, from an antioxidant perspective, molecular hydrogen is another one that upregulates glutathione expression as well.
Nice. How do you measure oxidative stress levels?
Yeah, good question. So there are three main markers that I can think of that can measure oxidative stress when we look at our panels. One of them is a molecule called 8-OHDG, 8-hydroxydeoxyguanosine. There's another one called MDA or malondialdehyde. And then the third one that I look at is something called lipid peroxides. Those are the three main markers of oxidative stress that we look at. to assess oxidative stress levels.
And those levels would be high or low?
High.
High.
High. Yeah.
Okay.
Yeah.
And as you start to actually treat the oxidative stress issue, you start to see those levels come down.
Yeah, we do start to see those kind of come down.
Interesting. All right, oxidative stress. Got to focus on that. That's key. So, and
Yeah.
that's part of mitochondrial health.
Yeah.
How do you measure mitochondrial health?
Well, good question.
I mean, we talk about mitochondria so much.
Yeah.
And you got guys out there talking about hypoxia therapy and for the mitochondrial health.
Yeah.
You got all kinds of different type of therapies, supplements, CoQ10. I mean, tons of stuff, right?
Yep.
And now you're starting to see people testing for mitochondrial health
Yep.
in multiple different ways, but there's a lot of questions out there about these
Exactly.
different tests.
Yeah. So there are several companies that are on the market right now that have come out with mitochondrial tests. I've not used any of the ones that are. We're speaking with one not too long ago to start to use one of the tests that are fairly new. In the past, we had been using this IGL test out of Germany, and it was by far the most informative test that I knew of from a mitochondrial perspective. It measured mitochondrial numbers, mitochondrial clumping. It measured mitochondrial membrane potential. None of which I don't know of any other test that does that. Even the newer tests that are coming out right now, I don't know that they measure the mitochondria like the IGL test did. IGL measured phospholipids on the inner mitochondrial membrane called cardiolipin.
Mm-hmm.
It measured cytochrome C oxidase and cardiolipin interactions. I know there's a lot of science, but so that test is no longer on the market right now, as we know, and hopefully that will be back on the market at some point because by far it was the most, again, the most effective way of measuring mitochondrial function. There are some surrogate markers of mitochondrial function that we can look at on organic acids tests right now.
Okay.
So if you look at the Genova test, there's some surrogate markers of mitochondrial function as well that we can use.
Nice.
But if a company comes along that is able to measure mitochondrial function effectively, efficiently, then that's something certainly that would be very helpful when we come up with our strategies for all the clients that we're treating.
Now, there's a guy, Brian Johnson. For quite a while, he said that he would test his mitochondrial health by doing the VO2 max.
Right.
Is that possible?
Oh, absolutely, absolutely. So yeah, that's a great way. Again, that's a surrogate marker for mitochondrial function, mitochondrial health. When we talk about VO2 max, we're essentially looking at a combination of cardiac health, pulmonary health, and cellular health, specifically mitochondrial health. I mean, if you want to look at the VO2 max, the mitochondrial health is a surrogate marker that we are able to detect from VO2 max testing. There is, I think, Frank Schallenberger has a whole. I think it was Frank Schallenberger has a whole education series on bioenergy testing, and essentially what he's looking at is mitochondrial function, thyroid function, and it's all based on VO2 max. And so, absolutely, I use that in my practice now too. As I'm thinking about, when you're looking at somebody's overall fitness. I'm looking at cellular health, cardiac health, and pulmonary health from the data that we garner from the VO2 max testing. So, great way to definitely a great way to look at mitochondrial function.
Nice.
Now, some of the things that if you want to get scientific about how you truly measure mitochondrial health, people are doing muscle biopsies, but that's not really doing a muscle biopsy and assessing mitochondrial function. I don't think that's really realistic from a day-to-day basis. It's not practical from a day-to-day basis.
Someone will invent a technology that's like inserted in you maybe one day or something, right?
Yeah.
Who knows? So when we talk about longevity science is 25 years ahead of medical practice. I've always said that a lot of the stuff that you learn in medical school is already like antiquated because by the time it gets research, by the time it gets approved to go into the curriculum, to then the teachers to get the professors get taught on this stuff, to then eventually teach it to someone who goes to medical school, where then now they graduate medical school, go through their whole residency, and by the time they start practicing whatever they learned 10 years ago, it's like we've already researched and learned a bunch of new stuff.
Right. right?
Right. So I've always said that, but I want to kind of hear what you say about 25 years ahead of medical practice when it comes to longevity science.
Yeah. So let me give you a good example. I'm going to give you an example in the cardiac space, in the cardiology space. For years and years, and everybody's listening, everybody knows what a stress test is. And you can walk on a treadmill, you ride a bike, and we do that test and increase the intensity of that test. And people exercise on the treadmill or the bike. And you can do that with or without imaging studies, right? Okay. And so let's just assume we're doing a stress test, we're on a treadmill, and we have our patients have them exercise, and they're exercising, and then we image their heart as well to look at blood flow to specific areas of the heart with the stress test to ascertain whether they have any issues with blood supply to their heart. Now, stress tests are designed to detect any blockages of, say, most of the time we say 70% or more blockage in an artery. We should be able to detect that on a stress test. If you have a 20%, 30%, 40% blockage, then you will not detect that on a stress test most of the time, particularly on the imaging. You may not see any abnormalities. So you get told you have a normal stress test. So what I mean by an example of longevity science and just health and wellness and how medicine should be practiced, period. Nowadays, we have to keep up with technology. There's an imaging modality called Clearly, which allows us to do a CT angiogram, which allows us to get a 3D reconstruction of your heart, image these vessels, and not only see the vessels, but see exactly, how much of a stenosis or blockage is there, but what that stenosis, what that plaque in the artery is made of. Is it a calcified plaque? Is it a non-calcified plaque? Is it a low-density plaque, which is a much more high-risk plaque that's more what we call thrombogenic? It's sticky plaque in an artery that's more likely to cause a heart attack. And the Clearly testing will detect a 10% blockage, 30% blockage, 40% blockage. And wouldn't you want to know as a patient, okay, if I had a 30% blockage, wouldn't I want to know that as opposed to doing a stress test and telling me everything is okay?
Absolutely. So you could start working on it, right?
Absolutely. So from a prevention perspective, when I talk about longevity, I don't see a role right now at all for stress testing. If I can do a CT angiogram with Clearly imaging and I can see exactly what's going on with their heart, I know exactly what type of plaque is in that artery, and I can start treating that patient well before this disease was detected by a normal stress test.
And even if the patient has that 70% blockage that you can, identify with the stress test,
Right.
you can still do it with the Clearly
Oh, absolutely. Absolutely.
test, right?
Absolutely. And you know what type of plaque it is. If you have a 70% blockage with the stress test, we don't know if that's a stable plaque or an unstable plaque. We have a much better idea of a stable or unstable plaque based on that plaque morphology and what it's made of based on Clearly imaging.
So why are not all cardiologists utilizing that as the golden standard?
It's new technology, and what your point you just made, right? It takes a while for this technology to be for this whole concept to be taken up and the studies to be shown that this is effective. But at some point, we have to understand when you start to look at what is technology advances so quickly. If we wait for years and these studies to come out to show that the validity of the test, we're way behind the eight ball. And that's the whole point that I'm making. We're way behind. I can show you patient after patient. Like I have patients that come to me that have had a stress test that are normal, right? And they had a 90% blockage in one of the arteries based on a CT scan.
Oh, man.
And this is a lady who was symptomatic. In women, and we're not going to talk a lot about this, but in women, the symptoms of heart disease are very different. They can be very vague. And she came to me with a bunch of vague complaints. Yet her lab report, I'll say this, I started with the labs because I looked at more than just cholesterol and HDL and LDL. There's a lot of other inflammatory markers, back to your oxidative stress, that give me some insight as to what the risk of heart disease is. And looking at her inflammatory markers, the risk of heart disease was extremely high. So I recommended, even after a normal stress test, that we do a Clearly scan. We did a Clearly scan. She had a 90% blockage in the LAD, which is considered a widowmaker. Okay. Those symptoms she was having, I was concerned about. This is now symptomatic coronary disease. So I ended up sending her to her cardiologist up in Connecticut. She ended up getting a stent in that LAD. All of her symptoms went away, and she's doing fine right now. Okay. So it's one of those situations where I used the technology that I had at my disposal, as well as the right biomarkers that I knew that she was higher risk with the testing.
Be honest with me. If she never did that Clearly test, right?
Yeah.
And stuck with the results from the stress test, where could this patient be today?
Well, I mean, I hesitate to think this, but it may not have ended well for her. Okay, or she would still be having symptoms and not know what the symptoms are from. Okay, that's what potentially would have happened with her. So
Wow.
it's we have to utilize the technology that's available to us, and it continues to evolve. I think that we also cannot get caught up in. There are a lot of things that I do: hyperbaric, the light therapy, cryotherapy, molecular hydrogen. That it's not standard of care, right? But for me, it doesn't take standard of care. When I see my patients getting better, that's all that's important, right?
Right.
And what we're working on right now is collecting all of this data, trying to be very objective about how these technologies work. We know that HBOT stimulates stem cell release. We know that it stimulates nitric oxide release. All of these things are beneficial from an overall longevity perspective. And so if you start to kind of look at the science that's behind HBOT therapy, the science that's behind light therapy, and that's going to be something that just explodes as well, then you, as a physician who is trying to keep up with what's going on in the space and trying to help your patients as much as you can, we cannot continue to sit back and wait for medicine to catch up with science.
Yeah, you can. And Dr. Davis, one of the things that I put a lot of effort in is when we go to a lot of these different conferences to get educated on new technologies, on different protocols, I make it a point to post on social media. We even have our camera crew there showing us at these different events, connecting with other physicians, other experts, and learning. And I tell medical providers that want to learn from us to share that information because your clients are going to want to know that you are keeping up with the times. Because there's a lot of medical providers out there that'll go into their cave and only take what they've learned 20 years ago and keep on practicing medicine the same way over and over and over.
Yeah.
And it's not helping their patients.
No.
So it's my recommendation for any patients that have a physician or any kind of medical provider, keep an eye on them. Make sure your medical provider is actually getting educated, furthering their knowledge, and wanting to learn. And if it's the type of physician that you bring up some of the stuff that we're talking on this podcast today, right? If somebody decides to go to their cardiologist and bring up their clearly test, if they push you away, that's a problem, right?
Yeah, true, very true. I think that one of the things that I try to do, not just take care of patients, but a lot of the modalities that we utilize, we have really tried to be objective about the findings so that when we present, and I present to physicians just as much as I present to patients now, because one of the things I want to do is to have other physicians, as they hear me talk, as they see the presentations, as they see the data in front of them, right? If you truly care about your patients, I mean, there's no misconception about what this data is showing you, right? And so it's super important in everything that I do to try to be objective about it so that we can educate other physicians that, hey, there is more for us to be providing for our patients. If you have an open mind, you just have to go out and find the knowledge because there's so much we could do for them. And so at the end of the day, when we talk about kind of improving our current medical system, there are a lot of things that need to change, in our society in general to improve our health as a nation, right?
Right.
But from a physician perspective, I think we have been taught and in a medical system that does not allow us to be free thinkers and really deliver to our clients, patients, what we truly could. And so what I try to do when I speak to physicians now is I will put cases up and I will show you exactly what happened. Like this Parkinson's patient, I did a talk right after that. This past week, I had an event and I had physicians from a local hospital in Sarasota come by and I showed everything that, what we had found. I showed the data behind it. And even to today, I got a text from the director of research at that hospital wanting to kind of do some work and understand what I was doing. That's the thing that changes the way we practice medicine.
Yeah.
That changes medicine.
Oh,
so,
yeah. And the thing is, a lot of physicians out there, man, they're frustrated. They're frustrated. They truly want to help their patients, and the science is there.
Yeah.
It's showing it. So, Dr. Davis, we've heard you talk at a lot of the conferences about environmental toxins, which I remember you telling me, or actually I heard you speak publicly. It's like, why is a cardiologist talking about environmental toxins, right? But we know why. And right now, there's a huge movement out there behind Robert Kennedy Jr. And it's the MAHA, right? Make America Healthy Again. And, this is something big that eventually, after he stepped out of the presidency race, he went under Trump. And Trump is supporting him with all of this stuff specific to the food that we're eating. A lot of these American companies, right? They're making good product of the same product in other countries that are regulating what goes into the food. And then secondly, a lot of the environmental stuff where honestly, when we started talking about environmental toxins before this movement, this Make America Healthy Again, I didn't ever see the government getting involved in a positive way when it came down to it. Actually, I had conversations with you about, man, we got to be careful how we talk about it. But now you got the big dogs talking about it where I'm just like, okay, let's go. I want to be part of it. I want to be part of this movement. This is what we've been talking about.
Yeah.
Let's dive deep into that. Like, I want to hear your input about some of these foods that we're eating, the crap that's going in our foods, the pesticides, the stuff in the environment, the water. Like, people got to know about this.
Yeah. So the last 2 years has been incredibly enlightening for me with respect to why we get old and why we get sick. And I say this day in and day out to my clients, new clients that come through. We get sick and we get old because of the environmental toxins that we are exposed to. Full stop. I don't have any other. I have thousands of environmental toxin tests right now, looking at all these other oxidative stress markers and inflammation markers. And if you were to go into my EMR and you look at how much glyphosate and BPA and insecticides and pesticides and herbicides and flame retardants and something called forever chemicals, PFAS, perfluoroalkyl substances, which are things that we like the pots and pans, the nonstick pots and pans, and the no stain carpets that we have, and the Scotch Guard that we spray on all of our furniture. If you were to go into my chart and you look at the records of clients that have these incredibly high levels of these things, heavy metals I left out, okay, other toxins like toxins from phosphate mines, you would be appalled. And what happened was I was doing environmental toxin tests before, but what I wasn't doing is I was just having people, the environmental toxin test that I use is a urine test. And I didn't see that many abnormalities until I was doing some research, and it came up that you should have your patients do a sauna before you do environmental toxin tests.
Why is that so?
Because that sauna mobilizes these toxins that are stored in fat and bone and other storage sources in our organs. I can't tell you the effect of it. Went from having hardly any of those toxins to everybody having 5, 10, 20 of these toxins that were extremely elevated once we started doing it after you do the infrared sauna or just doing sauna in general. So then I made it a policy in my office that before I did environmental toxin, everybody gets a sauna, okay? And I have a sauna in my office so that we can do this testing. I made it a policy that we get environment, they have to do the sauna before we do the testing. That was the biggest wake-up call over the past 2 years that I've ever seen. I mean, it really has changed. I mean, I think I probably helped more people by diagnosing, toxic exposures. The most common one that I have in one of my or two very just appalling stories. One was a lady who was bedbound on disability for the past 3 years, headaches, rashes, joint aches, literally couldn't get out of bed. Okay, and she had high levels of uranium and thallium and thorium. And I'm thinking to myself, what in the world is this? What is this from? Right?
Right.
Long story short, what I did was I kind of figured the one that was the highest was something called thorium. And I had to figure out what thorium was from. And when I looked up thorium, thorium is a phosphate byproduct, phosphate mining byproduct. So I went to good old friendly Google Earth and I put in her address. And she lives two doors down from a phosphate mine.
Wow.
So when she came in, I started talking to her. And she said, yeah, we live 2 doors down from the phosphate mine and they're on well water, right?
Wow.
So this is the kind of thing too when I talk about
It's like
you know
you hit
medicine.
the nail on the head on
Yeah,
that one.
yeah. And this is the kind of thing. This lady was depressed and had all these issues, and so prescribed sleeping medicines and antidepressants and anxiety medicines, right? But the problem was none of those things.
No, none of
So
that.
we took
Wow.
her through detox protocols with IV therapy and phospholipid therapy. And this lady now is back to work. Okay. Her energy levels are much better. And she's in a whole different place. And it's been 3 years of this sickness that she had when it was all this environmental exposure. So, needless to say, she's no longer drinking the water. They haven't moved yet, but they don't have any exposure to that water anymore. And her environmental toxin tests after follow up, they're much better now. And we still have some work to do, but they're much better. I had another lady who had beryllium. Beryllium is a byproduct of airlines, airline fuel.
Okay.
Well, she was in St. Martin. She lived in St. Martin. Her front, and I got this picture. This is amazing. Her front view of her porch is this beautiful Caribbean Sea. The back view of her house is the airport. Literally, the airport is about 20 yards from her house.
It's a beautiful toxic view, I bet.
And there's a beryllium, right? And so those type of things, and so those are extreme cases to prove a point. But my point is, you know, when we do environmental toxins, when you look at people having fatigue issues and cancer, right, and heart disease, all of these toxins cause oxidative stress and inflammation, which cause these chronic diseases. So, I mean, I'm not going to say that it's the end all and be all, but I can tell you a large part of chronic illness
It's
are
part of that.
toxins that we're exposed
And,
to.
and you know what? That's why people are speaking about it and they're being loud about it right
Yeah.
now. And you know that last story that you mentioned about the airport in front of that lady's house or in the back of that lady's house. Just imagine all of these people that work at the airport day in and day out.
Oh yeah, oh yeah,
You know, they're getting exposed to that stuff 24/7.
yeah.
They go to work, put in their time, 20, 30 years, and then you're ready to retire, and then you croak out because of the job that you just retired from. So this is something that we got to help these people out. We got to get the education out there so they can at least get tested and figure out what's happening,
Right.
you know, internally.
Right.
Now, these toxins, how does it affect the body? Like, what do these toxins do? Like, what's the mechanism inside of the body of
Well,
what's causing disease?
Lots of different potential mechanisms. You know, one of the things we learned from the IGL test that we were doing is these toxins can bind to DNA. This is called a DNA adduct. These toxins can bind to DNA and change DNA expression. What does that mean? That whole concept is called epigenetics. We're all born with our genes, but our genes are not our destiny. The epigenetic expression of genes is influenced by our lifestyle, what we eat, what we drink, what we're exposed to, how much stress we're under. And so we saw in that test, and another amazing part of that test was that we could find toxins that are bound to specific gene loci. Another great example, I had a patient who had Parkinson's disease, and it turns out she had chlorotoluene bound to a gene that's associated with Parkinson's. It was bound to a gene called tyrosine hydroxylase gene, right? So I won't go too much into the science of that, but when I found that, I was like, whoa, this can't be, right? But that wasn't the only case of that. I can tell you 10, 20 of those type cases where there were gene loci that had toxins bound to these specific gene loci that had something to do with their clinical presentation, all right? So one, affecting gene expression, and also when we talk about affecting gene expression, when we damage genes, that can be associated with a higher risk of causing cancer, malignancy. So toxins can act by that mechanism. Toxins can bind directly to, for example, let's talk about heart disease. Let's talk about how mercury and lead are associated with heart disease. I mean, oftentimes when anybody who's listening, if they had family members who've had heart disease, we all know what their cholesterol was, but I can bet you on one hand, I can count the number of people who've had heavy metals checked that directly are vascular toxic that can actually contribute to that heart disease.
Wow.
So directly injuring lung tissue, right? So many different things that these toxins can do.
And
Hormone
you
systems.
start hearing about when you talk about the mercury and lead, right?
Yeah.
Especially people who were raised back in the day.
Mm.
You got the fillings, right, in the
Mhm.
teeth. You have even mercury in fish, right?
Yep.
I think there's a difference between the organic and inorganic,
Yep.
but I'm not sure. I mean, I would go to you for the
Yep,
answer of
yep,
do
yep.
they both affect you negatively?
Oh, absolutely, absolutely.
Right.
And so there are lots of different. There are two different types of mercury: inorganic and organic mercury. And there's a test that we use from Quicksilver to help us understand the potential sources of mercury, as well as how mercury is excreted, how well a specific individual's detox pathways work to get that mercury out. And so that's one of the things I want to say too. We're always going to be exposed to toxins. And one of the things I tell all of my patients is that, we're gonna try, and we can try to be as healthy as we possibly can. But the one thing that we all need to do is to make sure we optimize our detox pathways. What does that mean? Optimize our liver function, gut function, kidney function to get these toxins out. Okay, and so we can say for another day what exactly this whole detoxification, how do we optimize? But we're going to be exposed to things like every single day. You got your people in your neighborhood who are spraying all these chemicals outside, and you're going to be exposed to these
Right.
things. So making sure our detox pathways are open. And I mentioned earlier using the sauna to mobilize toxins. Well, guess what? That same very sauna that's used to mobilize toxin is the best tool you have in your armamentarium to get these toxins out, to keep them out. So I'm the biggest proponent of infrared sauna, or sauna in general, probably of any physician that I know of, because when I think about overall health and longevity, if I had one tool to choose, and I say this again day in and day out, if I have one tool to choose that I want in my armamentarium, it is an infrared sauna.
So,
Okay.
all right, so let's talk about that. So, top 3 things to detoxify a lot of these toxins you get exposed to.
Yeah.
Obviously, number 1 is going to be that infrared sauna.
Infrared
based off
sauna,
what you're saying.
okay.
What are the next 2?
Making sure that you have an appropriately functioning GI system. Make sure you're having great bowel movements, right?
Okay.
These toxins are excreted in our feces and our urine. Make sure you're having good bowel movements. If you're not having a bowel movement every day, or 2 or 3, okay,
You got to focus on that.
yeah,
gut health.
you got to focus on the gut health. You got to focus on gut health. So, and then other tools. My top 3, man, that's a tough one, because depends on if we're talking about supplements or if we're.
Yeah,
I
I
mean,
would say supplementation,
I would
right?
say diet wise, just making sure you are getting enough nutrients and eating the rainbow, so to speak, right?
Right.
Eating the rainbow means eating fruits and vegetables, lots of leafy green vegetables, to get all of the vitamins and minerals and polyphenols and flavonoids that you need to actually allow your liver to function normally with respect to the detoxification pathways. That's probably the most important thing. Give your body what it needs to carry out these detox
Right.
pathways.
So, eating foods high in antioxidants,
Yeah.
right?
Yep.
Supplements, we're talking about glutathione, other type
Yeah.
of antioxidants, vitamin E, vitamin A, all
Yep,
that
all those
stuff,
things we
right?
talked about. Yeah.
So,
Yeah.
okay. So that's important. I mean, I think that infrared sauna is something that people definitely. I try to get in the sauna as much as possible, especially hearing you talk about the toxins and the effect that it
Yeah.
has on your body.
Yep.
So Dr. Davis, man, you got the new longevity center that just launched.
Yeah.
So I know there's more than just an infrared sauna inside of that longevity center.
Yeah.
So what makes it a longevity center? What is there? Just so we could give people a little pre-opening of what you got going on over there.
Absolutely, absolutely. I'm super, super excited about this longevity center. Okay, we kind of hit on it early on, very early in the conversation. We talked about the commonality when it comes to health and longevity is assuring that your mitochondria are working efficiently, and one of every technology that we have incorporated in the longevity facility has in some way an effect on improving mitochondrial function. And so, hyperbaric oxygen chamber, incredibly helpful. The data on hyperbaric oxygen just continues to evolve as well. Photobiomodulation I've talked about already, right? So light therapy. Molecular hydrogen therapy we've talked about. That we have that as well. Cryotherapy utilized for a lot of different reasons, but the main thing that I like about cryotherapy is that it's useful in improving metabolism, changing white fat to brown fat. Brown fat is this fat that has a lot more dense concentrations of mitochondria, right?
Okay.
And so it's great for helping to change the white fat to brown fat, so improving metabolism that way. We have the infrared saunas, of course, and then when it comes to the fitness aspect of this, so this is a longevity and fitness center, so that's what's so cool about it, merging the medical component with a fitness component as well, and so we've incorporated technology that's helpful in improving VO2 max, which we've talked about, right? So we have assessment of VO2 max using a device called PNOE, and that VO2 max, when we look at if there's one test that helps us understand my overall prognosis and my overall health and fitness. If I had to look at one test to tell me how healthy an individual is, it's the VO2 max test, otherwise known as cardiopulmonary exercise testing,
Okay.
right? That's the one test that we know is the most effective way of assessing how healthy someone is. And so we measure VO2 max, but then we have technologies that can help us improve that. It's a technology called VASPER, which is a combination of blood flow restriction, cooling, and using high intensity interval training.
Okay.
I have another device that's used for strength training called the ARX, Adaptive Resistance Training, which is a combination of eccentric and concentric exercise that helps you build and maintain muscle mass, right? Without having to go to the gym and at risk of lifting lots of heavy weights and injuring yourself. The one
right?
thing at 53 years old right now that I'm not doing any more of that I used to do a lot of is lifting a bunch of heavy weights. I mean,
Yeah.
I herniated a disc 3-4 years ago. You guys remember that, and from that moment on, I realized that it didn't make sense for me to try to deadlift 600 pounds.
Yeah.
So devices like this adaptive resistance ARX will be incredibly helpful. And as we know, as we age, again, one of the most important prognosticators is how well we maintain muscle mass, right?
Right.
So if we have technology that can help us maintain muscle mass in a 15-minute workout, then that's something that I want to be part of, right? And that's what I'm kind of bringing to our clients as well, utilizing, again, the technology and AI that's out there and all these strategies to help us kind of optimize our overall health.
And you know what? A lot of this stuff is extremely important when you talk about lean mass and those type of exercises and different modalities that you're talking about. Because, with the weight loss industry, even
Mhm.
with these GLP-1 drugs, and forget about the GLP-1 drugs, even these caloric restricted type of diets that you've seen before that, the ACG diet and everything else, people are losing weight, but it's not fat. They're
Yep.
losing muscle weight, which is
Absolutely.
actually probably one of the worst things that you can do when you talk about longevity
Yep.
is losing your muscle. So this type of training, I would assume, would be very beneficial for people that are going through these different type of weight loss.
Yep. One of the biggest
programs.
reasons, absolutely. I mean, that topic is a topic every single day in my medical practice, every single day. There are lots of people. There are lots of people on the GLP-1 agonists. It is because of the cardiovascular benefits. In the past, I've never been a big proponent of weight loss drugs, but given the benefits on the cardiovascular end, I certainly have been using GLP drugs, and I think they have been very helpful with respect to people losing weight. But the other things that the cardiovascular benefits, people with hypertension, unbelievable. Beyond the weight loss, their blood pressures are coming down well beyond how much weight they lose. They can lose a small amount of weight, but the blood pressure still tends to get much better. But exactly to your point, this whole issue with muscle loss as opposed to fat loss is a real issue. And so it's important that when we talk about protein intake, essential amino acid intake, and utilizing the right training strategies like with ARX and other modalities is incredibly important from a long-term perspective. You can lose weight, but if you're losing lots of muscle mass, I can promise you that long-term, that longevity part might not be as helpful as we think it is with the losing weight with the GLP-1s.
Amazing, amazing. Dr. Davis, we're hitting that time now. What is one thing that you want to leave the listeners with for them to make that next step in either their medical practice or their longevity?
Yeah. I mean, I think that just using the title that we had, I mean, I want you guys to be just longevity medicine is 25 years ahead of medical practice. Find a practitioner, listen to the things that we've been talking about, educate yourself. I mean, the amount of education that's out there on the web, and yeah, you have to have some guidance, but I can tell you from a health perspective, longevity perspective, health span perspective, there's a lot more to offer. There's a lot more of these, so to speak, alternative modalities that are truly moving the dial, and the science is there. So each and every one of you, I encourage you to be the CEO of your own health, educate yourself, and take control of your own health.
Very important, guys. We all know your body's the temple of God. Treat it as so. Make sure what you're putting into your body is going to give a benefit for yourself, for your health span, for your lifespan. Very important. Dr. Davis, if people want to find you, where do they find you?
Well, you can find me revealvitality.com. I'm in Sarasota, my main practice. You can find me here at Liquivida, Chief Medical Officer. So you guys can reach out to Liquivida and find me here as well. And if anybody has any questions, feel free to reach out to us here at Liquivida. You know, physicians, any other practitioners that are listening, if you guys want to be a part of this journey that we're on to change healthcare, feel free to reach out to us. We really are looking for we love taking care of patients, but at the end of the day, the more physicians we can get on board with us right now to take this ride, the better we're going to be in the long term as far as making a big difference in how we change health care.
Let's do it. Let's make America healthy again.
Yeah.
So, guys, thank you for tuning in on this podcast. Again, it was Dr. Davis here, our Chief Medical Officer. I'm your host, Sam Tejada. Make sure you like, subscribe, share, do all that fun stuff, and we'll see you for the next one.